Good afternoon. My name is Sharon Perkins, and I'm a second-year osteopathic medical student at the Philadelphia College of Osteopathic Medicine. Today, I'm going to quickly go over the topic of use of ketamine in excited delirium patients. By the end of this presentation, the student should be able to define ketamine and its mechanism of action, to talk about the history of ketamine, past and current applications of ketamine, and also discuss if there's any future usages of ketamine. Ketamine and its mechanism of action. Ketamine is an intravenous or intramuscular anesthesia medication primarily used for the induction of anesthesia. It's a non-competitive NMDA receptor antagonist, and it blocks the HCN1 receptors. It disrupts the neurotransmitter glutamate, which is an excitatory neurotransmitter. Glutamate is involved with learning, memory, emotion, and pain recognition. But of course, as with all drugs, there are some adverse reactions. The adverse effects of ketamine include dissociative anesthesia, which basically means the eyes remain open with slow nystagmus gaze. There's also unpleasant emergent reactions, which deals with vivid, colorful dreams, hallucinations, and out-of-body experiences. Cardiovascular stimulation is also involved, which includes but is not limited to increased blood pressure, heart rate, and cardiac output. So now that we've talked about ketamine, you're probably wondering, but what exactly is excited delirium syndrome? It's a syndrome of uncertain etiology characterized by delirium, agitation, and hyperadrenergic autonomic dysfunction. Stimulant abuse and other drug usage usually accounts for a majority of the cases. Mortality has been reported as high as 8%, and the cause of death include hypothermia and cardiovascular collapse. Ketamine has become a popular option due to its quick actions and side effects profile. History of ketamine. The history of ketamine was first synthesized in 1962 by a chemist by the name of Kelvin Stevens. He produced an excellent anesthesia, and it was short-acting. It was then used for human trials, and it was given the name ketamine because it's literally a ketone combined together with an amine. Ketamine began as veterinarian anesthetic in Belgium in 1963. In 1965, it was described as a compound with cataleptic and anesthetic action, but without hypnotic properties. In 1970, it was officially approved for human consumption in the U.S. by the FDA and was administered as a field anesthetic to soldiers during the Vietnam War. Past applications of ketamine. Initially in 1966, clinical usage on humans of ketamine was reported in anesthesia and analgesia. Quickly, it became a popular induction agent among anesthesiologists. Now, ketamine is increasingly being used beyond the operating room, demonstrating clinical utility in the fields of emergency medicine, critical care medicine, pain medicine, and psychiatry. The current usages of ketamine are not limited to intramuscular induction of patients with excited delirium syndrome, IV induction in emergency settings of patients in shock or with hypotension, patients with restrictive airways, induction of patients, especially children with congenital heart disease with right to left shunts, burn patients, pre-hospital and battlefield medicine, and for children who cannot use any other anesthetics due to side effects or allergies. Future usages of ketamine. We should be on the lookout for usage of ketamine for treatment of depression symptoms and acute suicidal ideation. We should also be on the lookout for the use of ketamine for alcohol withdrawal. There's also the role of ketamine in calming patients before CT scans in the emergency room, although future studies are not likely in regards to this topic. Just last week, the CDC officially declared racism as a public health crisis. And that goes right along with the fact that there's a public health crisis of ketamine. The public health crisis is the question of, is ketamine the new police weapon against Black lives? In August 2019, Elijah McClain was murdered by police officers. The coroner stated the chokehold, in addition to the ketamine, contributed to his death. He was given 500 milligrams of ketamine. As taught in this presentation, ketamine is a powerful sedative which can be given by paramedics to calm people down who appear agitated. But lately, some medical and legal experts have began to question its usage in police calls, especially against those people of color. Rest in peace, Elijah McClain.